Doctors, nurses, and EMTs of Reddit, what's the worst injury illness that you've seen someone refuse treatment for? Had a guy go into cardiac arrest in our station. He was promptly lit up and came back around soon after. He wanted to leave, and we told him that was a bad idea. It wasn't a long argument, as he kept going into arrest. Less dramatic than some of these, but a patient I knew refused consolidation, follow-up chemotherapy designed to kill lingering cancerous cells and maintain remission for his cancer in favor of some holistic treatment I don't know the details of. Unfortunately, he died within the year. My dad did 9 of his 12 chemo treatments and quit recently because injecting mistletoe into his gut is what he actually believes will cure him. Stage 3 colon cancer, and he actually believes modern medicine is a giant government conspiracy. I don't know what upsets me more, that he's got cancer or that he actually believes this crap. Gunshot wound to the head. As long as the bullet misses the brain, you can walk away from surprisingly gruesome injuries. Unfortunately, it can put you in a state of shock that leaves you resistant to anyone trying to help. Nurse in aged care. Gangrene from knee to ankle all the way to the bone. She had the chance to amputate a year or two before coming into residential aged care, but apparently said no. She wanted to die. She was only in her early 80s, sound of mind and no other medical issues. So instead of living for another 10 years, she died in horrendous pain, getting her dressings changed every other day and doped up to her eyeballs on morphine, unable to have any meaningful conversations with her devoted family and friends that came in every day. I'm quite a young nurse and it was the first time I'd seen gangrene in person. The seeing part was fine, but the smell, oh my frick, the smell. You would change the dressings in the shower after another hit of morphine and it would stay on you and your clothes all day. It's like wet, old band-aids X100, and like when you leave herbs in the back of the fridge too long and they turn to liquid. It's been 4 months since she passed and the room she was in still has the rotting flesh smell. You would be surprised how many people refuse treatment for crushing chest pains. The only real thing you can do is wait for them to collapse and then treat. Unconscious people equals implied consent for treatment. The Bill Cosby rule. Kid I knew in high school had cancer. His family didn't believe in modern medicine. They belonged to some sort of weird religious group. He instead went to the chiropractor and was treated naturally. Let's just say I don't know this kid anymore. Letting your kid die from cancer due to your own ignorance and negligent parenting. Poor kid. EMT story from 2010. Haven't worked the band-aid box for years, but this stuck with me. Had a guy one time who had a stroke the year before and hadn't taken his meds after his discharge. He was rocking at 250/170 BP. That is not a typo. Had a second unit come by to double check. We tried for 20 minutes to convince him along with his daughter, but he was convinced he was just fine. The kicker was he literally lived 2 blocks from the hospital. I can't imagine he lasted much longer, but I never found out anymore. I'm an ED tech. Absolutely massive diabetic man comes into the ED with his leg wrapped in a plastic garbage bag. Paramedics said he'd refused to remove the bag. They didn't need to tell us something was clearly horribly wrong, as the stench from this man was horrific even in a well-ventilated area. A nurse finally threatened, cajoled him into removing the bag, and his entire lower leg is a horrific mess of gangrenous flesh. The foot had actually turned black. I was only 2 months into working in the ED and this was the first time an injury actually turned my stomach. The smell permeated everything. Can't imagine what the other patients were experiencing. He was informed that the limb needed to be amputated or it could lead to sepsis, I believe. He was in total denial, insisted that he was fine. He refused treatment and left the EDAMA. No idea what happened to him, but he did ask for his trash bag back. Oh, he died. A pregnant Jehovah's Witness involved in a car accident and refused blood transfusion. 5 hours later baby died and then she died. I grew up in that cult and used to carry a no blood card around. I'm so glad I got out of that religion. I tore that card up a few years ago. I had a patient who was elderly, but in her right mind. She came into the hospital via ambulance with no family still lying on the sheets we sent her home with the last time. She had terrible pressure ulcers and was covered in excrement. Come to find out, She was the mother of a wealthy dentist in the area and actually lived with him. He was neglecting her horribly. A referral was made to a long-term care facility and social services was notified. But because she was in her right mind, she chose to return home to those terrible conditions. That's heartbreaking. I've had to talk way too many people into getting treatment for their heart attack. Like, why did you call 911 for chest pain or go to the ER only to refuse treatment? Not a med myself, but last time I was at the hospital there was a guy with tuberculosis who refused treatment because it was all propaganda from Big Pharma, yet he wanted to make the doctors to make him feel better. TLDR. Refusing treatment for broken penis. Oh man, I really don't tell this story very often just because it's NSW. I used to work as a medic with an outfit in the Dallas Ft. Worth area of Texas. It was not uncommon to receive call-outs from the 911 dispatcher with little to no information on the situation going on. Usually an address and maybe the patient's condition or complaint if we were lucky. On one such call we arrived to this hole-in-the-wall apartment complex to see the city FD paramedic engine had already beat us to the scene. I asked one of the fire guys standing by his rig what was going on with the patient. He shrugs his shoulders and tells us he hasn't a clue. LT just told him to make sure and let us know we needed to prepare for a contaminated scene by wearing full PPE, mask, gown, gloves, goggles, etc. So as walk into the apartment doorway, the first thing I noticed was a late 20s naked female caked in blood passed out in a corner of the main living room. A second similar appearing female was barely cognitive on a couch, talking to a fire guy and trying her best not to slur her words. As my partner and I started towards these patients, another fire guy grabs us by the arms and drags us to the bedroom where we were apparently needed the most. First impression? Well, do you remember the scene in A Nightmare on Elm Street where one of the female leads is dragged across the walls and ceiling of the bedroom? Well, this was exactly what I was looking at. Blood splatter dropping off the ceiling, bloody handprints and streaks along the walls and floor. The room was bare except for high quality recording equipment in one corner, drug paraphernalia littering the floor, and in the center of the room laid a blood-soaked mattress with a man on top laying in a fetal position and rocking back and forth clutching a ratty pillow. Turns out this man was filming himself and two other call girls in what I can only imagine was supposed to be one epic drug-filled ragging threesome porno. Unfortunately for the man, right as he was to ejaculate he hit one of girls the wrong way, breaking his penis in the process and ejaculating blood all the ceiling and the girls. This no doubt frightened and confused the poor girls as they stumbled back into the wall, smearing them with blood in the process. The cherry on top of this entire incident was the man refused to be transported and treated at a nearby hospital even after explaining to him this would likely be the last time he would ever be able to have sex or urinate normally again unless he sought out urgent medical attention at an ER. Fortunately the Leos were able to talk some sense into him, but my god, what a way to go out, haha. Ejaculate blood. Oh my god, I'm gonna puke. A story from my friend who's a specialist breast cancer nurse in the UK, but in an area with a large West African population. A complicated subject, but in a nutshell there are quite a lot of patients who don't pursue Western medical treatment in favor of faith healers or similar, and may only return to hospital when things have reached a dire point. She told me about a lady who showed up one day, having not attended follow-up for months after diagnosis. When she examined her, she found the cancer had caused a festering wound in her chest that had eaten a hole through the flesh so deep that when my friend shone her torch and she could see her aorta, the lady had just been stuffing it with tissues and hoping for the best. Now just imagine how many people in Africa itself there are that do similar crap. And then when they eventually do go to a hospital, it's so underfunded that they never had a chance of surviving this thing from the beginning. Student dietitian here. While on placement, I witnessed a patient be referred to at a with end-stage kidney failure for dialysis. He hadn't been diagnosed with kidney problems, although he had noticed that when he had a big meal and a few drinks he felt a bit itchy and sore, presumably when he was overloading his body and his GFR was on the floor. Said he didn't think he felt that bad and left. Pretty sure he would have died within a short while without a transplant or at least a good dialysis regime. Was an EMT, but this one's about a call my father was on as a firefighter back when I was a kid, in the early 80s. Guy had fallen through a glass coffee table and cut his throat ridiculously wide open. Looked like he had a second mouth. Somehow managed to avoid the carotid arteries, but was still seriously bleeding. Oh, did I mention the guy was drunk out of his mind? Refused assistance. I believe the exact words were, "Do I freaking look like I'm on fire?" from my dad's crew. Same with the cops who got there behind him and the ambulance that got there a while later. Early 80s. Zero paramedics. The ambulance told him multiple times he needed to go for immediate surgery, or at least a shitload of stitches, and was so blasted out of his mind that he couldn't recognize how badly injured he was. He wanted the crews to frick in the general direction of off. Eventually the cops told his wife, "We're all gonna wait out here on the road until he passes out from blood loss and then take care of him after he's unconscious." He finally realized they were serious and, with a bit more cajoling especially from his wife, he went in and got sewed up. Frick in the general direction of off. I may need to use this from now on. I'm not a doctor but was the patient. As kid I was afraid of doctors and hospitals for some reason, and when I was like 11 or 12 I was walking across the street to get the mail when I got hit by a car and was hurt real bad, and someone called 911 without me knowing, so when the paramedics got there I tried to run away. That's adorably hilarious. Yesterday I heard about 24M with pancreatitis who refused hospitalization. For those who don't know, acute pancreatitis is your pancreas being digested by itself. Quite deadly, especially if you try to walk it off, only to be rushed back to hospital the next day. My brother has been refusing to take insulin for about the past 2 years now. He's read a bunch of articles and watched YouTube videos saying that a vegan diet mixed with intermittent fasting will kickstart his pancreas and cure his diabetes. Since he started this he's gone from 5 feet 8 inches and about 135 pounds to 96 pounds when they weighed him in the ICU this past week. He developed a pretty serious case of DKA on Tuesday, and when my dad took him to the hospital his blood sugar was over 1000. It was really hard for the doctors to be sympathetic with him because his illness is manageable if he just takes his insulin. They see people day in and day out who would give anything to beat cancer or dementia, but there's nothing they can do. My brother wanted to take charge and try to get his organs working the way they're supposed to. He thought if he took the insulin they gave him that his body would never start to produce it because it didn't absolutely need it. He's been grouchy and depressed for a very long time because his body was never actually getting the nutrients or calories from the food he was eating. He was extremely strict with his diet. I've never seen that level of dedication from anyone before. I think he's realized he is gonna have to start taking his insulin on top of maintaining a healthy diet or he won't make it very much longer. IDK where I'm going with this rant. All of the emotions are still pretty fresh since he's still in the hospital. She didn't refuse treatment. She was demented and had a medical proxy. Poor old lady was dying of congestive heart failure. Basically, your heart doesn't pump as hard as it should, so blood backs up into your lungs, increasing pressure in those small vessels causing fluid to leak into the lung tissue. TLDR. You drown on your own fluids. We were keeping her pretty out of it because it can be quite frightening, particularly if you can't remember that you are ill. What sticks with me is when she would have brief periods of lucidity, she would ask for a Claritin for her allergies. She thought her CHF was just bad allergies. Poor lady passed away a couple days after, but she went peacefully. I don't know why, but the tragedy of her asking for a Claritin will stick with me for the rest of my life. Had a H overdose come in and refused treatment once he was awake, so once we felt he was okay enough to go we let him go, only for him to come back in several hours later, this time dead, from a second H overdose. Funny H overdose story told to me by a paramedic pal. Guy calls saying his girlfriend has OD'd and is non-responsive and he's trying mouth to mouth. Pal gets there, guy's giving mouth to mouth to a teapot while near dead GF is lying next to him. Guy insists teapot is GF, has to be restrained so partner can seat a girl. Couldn't make this crap up. A man was coming into the coronary care unit, CCU, to visit his dad who had just had a heart attack the day before. On the way out, he starts feeling sweaty and has crushing central chest pain. Read equals heart attack. We get him to sit down, do an ECG and find widespread SAINT elevation. Read equals big heart attack. Tell him that he probably needs to be admitted but he denies all treatment. Tries to leave the hospital as fast as a man having a heart attack can do so before collapsing conveniently near the emergency department. Following stenting of his coronaries, we couldn't get him a bed next to his dad on CCU, but they were close enough that they could have conversations. AWW. That's kind of sweet. My girlfriend was longboarding in Peru, and she fell and cut her knee. Except it wasn't just a cut, it had actually sliced all the way down to the bone and tore a lot of skin off around it. She got up, not realizing what had happened, and continued longboarding for a while. Hardcore. Saw a person with heart attack refusing to get admitted and he left after streptococcus infusion was over. I saw him going about his chores many months later at a convenience store. He was apparently doing fine. Guy who loved to travel gets leukemia, doesn't want to poison his body with antibiotics on top of the chemo, refuses antibiotics, antifungals, antivirals etc. Guy has unbelievable worms coming out of him. Just unbelievable. Patient with history of 15-year IVH use presented to Maya today in septic shock secondary to large abscess at one of the injection sites on the right arm. Due to the patient's history of long-term intravenous injection, multiple unsuccessful attempts at gaining IV access were made. Ultrasound machine was then brought in and her antecubital vein on the unaffected arm was deemed the only site available. Patient then expressed desire to leave AMA because this is the only site I have left to inject and I don't want you to ruin it. Explained to patient that in all honesty, they would still be able to use the site for later IV drug use. Patient did not trust this information. Patient was advised she would likely die in hours to days without treatment. Patient still wants to leave AMA. Patient then offered central line which the patient promptly declined. Patient left. Not the most physically gruesome injury illness, but the degree of addiction in this patient was pretty psychologically gruesome in my opinion. Patient would rather die than run the small chance of losing the only usable site patient deemed self-accessible after recovery discharge. I have maybe a different take on this. I'm a nurse on a behavioral medicine unit, and there is one patient that I keep thinking about years later. He was a handsome young man, married to a beautiful wife and had a beautiful daughter. Really was a picture perfect family. Early 20s is when schizophrenia usually shows up, and this poor guy was already married and had started a family when it began to manifest. He was acutely paranoid and extremely delusional. His hair became long and unkempt, long messy beard, etc. He refused food and water, refused medication, and had a reason, usually religious, for all this. It went on 4 weeks until we were finally able to get him into the state hospital, where he tried to escape but was able to talk his way out in just a matter of weeks. Last I knew, he was in the paper after he abducted his daughter and was found in a hotel several hours later. Luckily the daughter was safe. Mental illness can be every bit as acute as physical illness. Crocodile that missed a vein in her arm, ate away so much flesh, smelled awful, and both the bones in her arm were very visible. Her elbow was only bone, no skin or muscle. They were blackened. As soon as they mentioned cutting her arm off she dipped. Croc quick kills. We get people over and over for ODs of M&H, but usually croc is just a body coming in to wait for examiner. Drugs are bad. Forgotten respiratory therapist here. I've had people refuse oxygen when their pulse ox was in the 60s. And of course they are code 1. So we just end up intubating them when they can't make their own decisions anymore. It's really sad and frustrating. My dad has severe end-stage COPD and when his oxygen drops he becomes disoriented and will refuse treatment. It is so frustrating. He has technically died a couple of times. People refuse treatment for stuff like cancer and CHF all the time. I can understand it in a way, but it seems crazy for your gut reaction to a cancer diagnosis to be just shrugging it off. Guy came in with osteomyelitis and gangrene of his foot leg up to his knee. Started as a bump on his shin that spread and ulcerated and wouldn't heal. Antibiotics and debridements as well as skin grafts were doing nothing for him. Could see down to bone and exposed muscle in parts not covered by fascia, as well as parts that were fairly eating away. This guy's had terrible diabetes that wasn't controlled in any way, shape, or form because he thought he could heal himself with prayer. Basically his only option was an amputation. Below knee wasn't an option because his tibia and fibula were eating away like Swiss cheese. Through knee was maybe possible. Pretty high above knee amp was probably the only way he was going to keep any semblance of his leg without doing a full hip disarticulation if this thing spread anymore. But he wanted a second opinion and decided to leave the hospital against medical advice. Despite us saying there was a massive infection in his leg and the need for systemic antibiotics to keep it from spreading any further, he figured his podiatrist, who was the one who sent him to the hospital in the first place to get a possible amputation because this was beyond the scope of his practice, would have some magical formula to cure him of his problems and he would get full recovery and use of his leg. I wanted to punch this guy in the face repeatedly before he signed the AMA papers and left the hospital. About a year ago, young guy, H addict, comes into emergency. Nice enough guy, just a problem with drugs. Some guy has beaten him with a baseball bat. His arms are all sorts of crazy. They look like the arms of Mr. Tickle. I x-ray them and he has so many breaks you couldn't count. He needs surgery. He needs his arms put back together. I take him around to wait for the doctor and he can't wait. Said he can't be bothered and wants to go shoot up. When I asked him how he was going to do it, he said he would find a friend. Walked out of the department, arms flapping in the wind, never to return. Man tried to control his hypertension the natural way through herbs and spices. He stroked. He was a fit and active man, but sometime genetics win. He stroked. Didn't realize that this is also used to control hypertension. Paramedic. I had a drunk dude that jumped from a second floor balcony and broke his femur. Refused transport. Family took him in the next day. It was a close break at the ball with minor rotation, so not nasty looking but definitely still broken. This is why in my system, intoxicated people cannot refuse. EMT here. Lady OD'd and her husband found her unresponsive and turning blue. Guy slams Narcan into her. Temporary fix. We show up and the lady argues with me about going to the hospital. Says if the Narcan wears off and she goes unresponsive she'll call us back. Told her that's not how it works. Necrosis of the penis. Like black. Chunks of skin falling off. Could not pee without catheterization. Doc said the only option at this point was to get a penectomy, removal of the penis, and the guy refused. So all they could do was keep scraping the dead skin off. It was freaking horrifying. Really bad motorcycle accident. His left leg was so destroyed, we couldn't even figure out where his ankle was. We eventually found it because his bone was sticking out. We took care of cleaning it the best we could, and covered it while we waited for the doctor. He said he couldn't wait anymore and he'll take care of it at home. Got up and literally wobbled out. Always wondered what happened to him. He dead. I'm not a doc, but a social worker. My grandmother, who lives about 5 hours from me, suffered a fall in the shower. My mom found her, and she seemed alright aside from needing help to the bed. She was about 87 at the time, and my mom called me to tell me what happened. She and my dad were still at my grandma's house with her. Grandma said she didn't think she needed to go to the ER to get checked out. I told them that they had to take her to the emergency room, and to not take no for an answer. One of the things we were taught in my geriatric social work class is that a fall is very rarely just a fall in the elderly, and there is likely some precipitating factor. I told them to explain to her what I had said, and she agreed to go. Sure enough, they take her to the ER and tests are run, and she has a major blockage in her large intestine and has to have the majority of it removed and a permanent colostomy placed. She did not know that her diverticulitis had gotten as bad as it had, which was what caused the blockage. The doctor who performed the surgery stated that if she waited a day or two, she would have died. She still brags on me for saving her life from 5 hours away. She's doing pretty well now and is in assisted living, and she is taking the ostomy in stride. She gave the darned thing a human name. She's gotten mobile enough that she is able to go to my parents' house for holidays, which she wasn't able to do in the months just before and after her surgery. She'll be 90 in August. It's nice to read a story in this thread with a happy ending. Good on you for sticking to your guns. Story time. I'm a paramedic now, but I was in training when this happened. We got dispatched to someone not acting right. On scene we found a guy who was extremely agitated and refusing to go to the ER. He said he'd just keep peeing out his belly button and stay home. Thinking psych, we tried to convince the guy to go to the ER and it just wasn't happening. The guy is now escorting us out of his house when I feel something warm and wet on the back of my legs. I turn around and there's a stream of fluid coming from the patient, but it doesn't look or smell like urine. At this moment, the patient sneezes and several loops of intestines come out of the patient's necrotic belly button along with what seems like a gallon of fluid. Patient keeps trying to shove his intestines back inside of him, making the most god-awful noises ever with death-smelling fluid pouring out of him. He's still refusing any and all treatment. I got on the phone with medical command and they gave us authorization to bring him in under the altered mental status protocol. So we get the guy on the gurney with a fight, but he slowly starts to lose steam and became less lucid. In the ambulance, the fluid kept pouring out of his stomach and I wrapped his intestines in saran wrap. We got to the hospital and the back of the ambulance was covered in what we found out was acidic fluid. He had such horrible, untreated ascites that it ate away his belly button from the inside, causing everything to spill out. He ended up dying from liver failure and various complications a few hours after we brought him in. Read the whole thread and this is the one that got me. I work admitting foreigner and I'm used to dealing with some screwed up stuff, but so this takes the cake. Congratulations, I gagged on water trying not to imagine the smell. Medic here. Active massive heart attack. I even went so far as to call the emergency room so the doctor could tell the man over the phone that he would be dead very soon. He still didn't believe me. He refused transport to the hospital because he wasn't going to miss his son's graduation from 6th grade. I'm pretty sure he's dead now. That's some freaking dedication though. I'm kinda jealous. My parents never came to anything ever for any reason. Not the worst, but certainly the easiest fix with the worst consequences. I had a patient refuse surgery for a colonic obstruction because he was not willing to ever have a colostomy. He had friends and family who had had one in the past. He was otherwise totally reasonable and competent, and staunchly refused the surgery, which was the only treatment. He knew he would die without surgery. He, unsurprisingly, developed ischemic colon, peritonitis, abdominal sepsis, and died about 36 hours later. I'm just going to tell you, I am freaking fearful more than anything else of the idea of having a colostomy. It's irrational I guess, but the idea of it freaks me the frick out. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.